Thank you. Now I want to. Bobby is here. Yay. Okay, and then I want to be able to get the. Okay. So Chaz, I think we're going to give everybody a couple more minutes to join us, and then we will start the presentation. I should say the riveting presentation.
Sounds good.
Thank you.
And don't forget to reshare that.
Oh gosh, I'm so glad you did that, because Did that come over okay?
Yes, it did.
Thank you. We'll start at 12:03, okay, Chaz?
Sounds good.
We got some good feedback last time about that window behind me. It was glary. I didn't want to be glary or anything. Um, All right, let's get started here. So thank you everybody for attending. Welcome to our October 2024 webinar. I'm very excited to share this information with you guys today. In our opinion, we found that this topic, healthcare and retirement, is one of the most researched topics on the internet with the least amount of direct answers. So what we're hoping to do is help you guys figure out, where do you even start? So we hope to answer some of those questions. I would like to introduce, if my screen will screen for it. Okay. I'm going to introduce our team today. I'm Kelly Olczak. I'm the managing partner of LynnLeigh Company. We manage the finances for a handful of families in the Rochester, New York areas, as well as throughout the US. We are a 100% woman-owned registered investment advisor located in the Bushnell Basin in upstate New York. Registered investment advisor means that we are fiduciaries. Additionally, I'm a certified financial planner and I've held that designation since 2009. I also want to introduce Chaz Miller, who is our operations manager. And she's going to be our moderator to help you guys ask questions via the chat function on Zoom. We really want you to chime in. There's a lot of information we're covering, but we want you guys to feel free to ask questions and raise your hand. So she'll help tell me to stop talking when you've got questions. Also attending is my partner, Becky Gillette. She's our chief compliance officer. You know, very few firms our size have a dedicated chief compliance officer. She's focused on our operations without managing people's money, and we're really, really grateful for her watchful eye. One of the things we really enjoy doing is educating our clients, prospective clients, so you guys could become better informed investors. So today's big topic, we'll be covering some of the most important aspects of healthcare planning and retirement. Our goal is to help you understand your Medicare options, how to plan for rising healthcare costs, so you can build a sustainable budget through retirement. Now, in the past, about a year ago, we did have a webinar that went deep dive into Medicare and how to enroll. And so we're going to include a link to that webinar so you can go back and look at it if you want more detail. We're going to take a little bit of a deeper dive on this one to understand your options and help you understand the potential costs so you can plan. I'm a planner and I love planning. So I found this chart and it sort of started this conversation that we have. Oh, before I go any farther, I must say this. We're going to have one poll to make sure that we stay on topic. I'm going to have Chaz launch that poll for us right now so that we can make sure that we're answering questions that you might have. So if you just take a couple minutes to help us with that, that would be great.
Couple folks making their way through that, Cal. I will leave it open a little bit longer.
This is really good feedback for us so we know we're on track. So thank you. We're almost done. Try and make these polling questions fun. Great. Just a couple more seconds and we'll be done with this. Thank you very much, you guys. Okay. So some of the question, uh-oh, what did I do? Chaz, did that mess up my screen share?
It did.
Of course. Is it back?
Yes.
Good. Right. So what I'm seeing from our polling questions are, hang on a second, I'm gonna mess this up again because the window is gonna do that. All right, hold on. All right, there we go. So some of you guys aren't retired yet. We're looking to understand basic concerns around control and cover costs of retirement. That's awesome. Thank you. Okay, I think we're going to cover a lot of these questions, but feel free to reach out via chat if I get into an area and you want to know more, okay? So here we go. So this pie chart really illustrates the breakdown of healthcare costs in retirement. Nearly half of annual spending, around $2,294, goes toward the premium. This is per person, not per couple. And then there's an additional $3,166 that is spent on other services, including long-term care. And typically we do see the average cost for each person about $6,000 annually. And that's without inflation. That's just in this research was done for 2016, but I think it's still quite relevant, and these numbers will rise. We know that, and so part of our discussion today is around how to prepare for that. Okay, so let's break down Medicare, what it is and what it isn't, and I'm going to just start with high-level basics. So Medicare is divided into 4 parts. Part A covers hospitalization. Part B covers doctor services, outpatient care, if you are in the hospital, durable medical equipment, that sort of thing. Part C and D, so Part A and B are covered by Medicare. Part C and D, that's where private insurance comes into play. So Part C, what I like to do, the way I like to remember Part C, which is called Medicare Advantage, is that A plus B plus D equals C. That's Medicare Advantage. So you can sign up for a Medicare Advantage plan that's offered through private insurers and get all your services under one umbrella. Private insurers are companies you might be familiar with, Blue Cross Blue Shield. In our area, that's Excellus. Aetna, there's a handful of providers in the county. Medicare is run at the county level. So I think many of you are from, that I see on our webinar right now, are from Monroe County. So when I talk about providers, if you live in Livingston County, there might be different providers. Anyhow, so instead of Medicare paying for your hospital visits when you have a Part C plan, Excellus will pay for that. The Part D is your prescription drug coverage, and that is also provided by private insurers who contract with Medicare. And each prescription drug plan is slightly different, which is why you want to shop carefully for those drugs, because if your drugs are not covered, you might have a problem there. Even if you don't take prescription drugs, when you first go onto Medicare, you'll still want to sign up for a Part D plan, because if you go without drug coverage, you could face a penalty over a lifetime. So referring back to that slide, considering the out-of-pocket costs, you might be wondering what Medicare does cover. So it covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor bills, and it covers some preventive services. At the end of this workshop, there are some handouts you'll be getting, and one of them is called Medicare and You. Some of the resources that we have at the end of the workshop are based on 2024 numbers, but the Medicare and You piece just came out, and that is the 2025 numbers. I will be updating the 2024 handouts Medicare updates everyone in the middle of October of each year. So the 2024 handouts we have are very good. But when they do update, probably in November and December, I will make sure you guys get that current data. So when you look at this Medicare and you booklet, it spends 20 pages talking about what Medicare does cover and only 1 page on what it doesn't cover. I'm not talking about partial payments. I'm talking about no cover whatsoever for this list of services here. So some of these things you could avoid. Cosmetic surgery is optional. But if you go outside, if you travel outside of the US, you might have a problem. Some Medicare, this is the advantage, this is part A and B. They don't cover dental, they don't cover eyeglasses or hearing aids. This is where that Medicare Advantage plan or part C comes in handy. So this table gives you, and by the way, this presentation is being recorded. So you can always come back to it and look at it again. We're going to cover a bunch of stuff. But this table shows you the part B and D premiums for different income levels. So if you're single and your income is under 130,000, or if you're married and your income is under 206,000, you'll pay the regular Part B premium of $174.70 per month. That typically comes out of your Social Security payment. Even if you get a Part C, you're still going to pay that $174.70 out of your Social Security payment. If your income falls into one of these other tiers, the premium is more income related. For example, if you're in the second tier, you'll pay an extra $69.90 for Part B and an additional $12.90 for Part D on top of your regular premiums. So it'd bring your total to about $257.50 per month. Again, it's per person. So if you've got a partner, you want to double that. Your tax return from 2 years ago is what determines the income-related adjustment. For example, the adjustment for 2024 would be based on your 2022 tax return. And keep in mind that premiums shown here do not include premiums for drug plans, Medicare supplements, Medicare Advantage plan. This is only for Part B and Part D. Part A is free if you qualify for Social Security, meaning you've worked 40 periods. So there's no real Part A quote premium. So Part C, this again is where private insurance comes from. And the private insurance companies have many different, I'll give you a couple examples in a minute, but they have many different flavors for people. So a Part C Medicare Advantage can cover all or part of your deductibles. Those hospital costs after 60 days, the 20% of your doctor bills that Medicare doesn't pay, but extra services can increase your premium. Sorry, guys, I have a hair in my eye, of course. And of course, all prescription drug coverage that is offered through private insurance who contract with Medicare, again, that'd be like Excelis or Aetna. Those prescription coverages are based on the types of prescriptions you have. That is called your formulary. Everybody's formulary is different. So I see there are some questions. Yes, you will definitely get a copy of the slides. And Bobby, when you based on income, if you are retired or collecting social, is that your income? Yes. And income from your IRAs or pensions also. Thank you for these questions. This is great. The other thing I want to tell you is that I've worked so hard to try and cover all of this stuff. There's so many different ways we can go. I'm going to do the high level stuff, but feel free to give me a call if you want more detail because we could go on and on. There's a lot of moving parts. Okay, so as I mentioned before, Medicare is run while it is a federal program, each county is responsible for the offering. So Bobby, you down in South Carolina, North Carolina, we'd have to look at the county to find your plans, but you'll have choices, okay? So this is Monroe County, and you'll see there's 3 options here: WellCare, Excellus, Aetna. And believe it or not, there are premiums that are $0, which I've had some people say, well, I don't want a $0 premium. That means it's cheap. Not at all. The federal government subsidizes your Medicare Advantage plan. They would pay one of these companies, whichever company you decide, $800 a month to cover some of your costs. Now, the 0 premium is based on how much prescriptions you need. All right. So if you don't need a lot of prescriptions, you might have a $0 premium. The MOOP is maximum out-of-pocket costs. And in this example here with Excellus, this plan covers dental, vision, and hearing. It allows you to have an in-network or out-of-network. Okay. Whereas the WellCare program does not cover dental, vision, healthcare. You'll see the Aetna has a PPO plan, and the PPO plan, so if you travel a lot, you don't want an HMO. You want a PPO, because that means you can go out of network if you've got kids in San Francisco. You live in New York, but you spend a couple months out, out of state. You want a PPO plan, okay? The other thing to know is you can change your plan every year. We'll go over that a little bit later. Any questions? Okay. So the next thing I'm going to cover is this thing called Medigap. Medigap only works with Medicare Part A and B. So you want to think about Medigap as an overlay for that Part A and B. If you don't have Medigap, you are essentially responsible for any out-of-pocket costs. So these Medigap plans can help you fill the gap. Isn't that cute? Fill the gap. So it is also run at the state level, and it's standardized. Every state has a standard set of plans. There are a couple that have their own, Massachusetts, Minnesota, Wisconsin. It does not work with Medicare Advantage. That's Part C. You pay a premium for that, and costs vary based on your location, who the company is, what kind of plan you need. So here's an example of the different Medigap plans. So there's type A, B, C, D, and you'll see on the left-hand side, it's talking about what it covers. Plan F is the mega plan. It covers everything, but you may not need everything. Okay, so some of my clients have TRICARE, which is a military healthcare overlay. They may not need Medicare Advantage, so they'll go Part B, A, B, and D, and then choose this Medigap plan to cover any gaps that TRICARE doesn't. That's what this is, not just for TRICARE, but it's a way to, like I said, cover gaps. Okay, so let me give you a visual. I'm a visual learner. So these are your Medicare options. So original Medicare is Part A and B. You still need a Part D. That's your prescription. Additionally, there's no limit on out-of-pocket costs if you have A and B and D. Then there's Part C, which is Medicare Advantage, and that covers all of A, all of B, and all of D. And then that Medigap piece that fills the gap for original Medicare. Okay, but wait, there's more. Many when we looked at the research, we found that there was not a lot of discussion about how Medicare would be complete without this Medicare donut hole, and it's a real thing. A lot of folks are surprised when they encounter this donut hole, so I felt it's really important to at least discuss this. So here is a section on how this works, and this is all about prescription Part D Medicare. Okay, so there's a deductible phase. You start by paying the full cost of your medication until you meet the maximum deductible, which is $545. The initial coverage phase. After meeting your deductible, your plan helps cover prescription drug costs, and you pay a copay or coinsurance. Then you hit a donut hole once you're over $5,030. So you will be responsible for 25% of your drug costs. There is a catastrophic coverage. So after spending $8,000 out of pocket, that's when you leave the donut hole and enter what's called the catastrophic coverage phase, where your costs will drop significantly and your plan covers most, but not all of your expenses. And then the exciting part is it resets every January 1st. In my experience, I've seen very few people that do not have Medigap coverage be able to get out of the catastrophic phase or even coverage gap before the end of the year. Okay, now, I'm sure this donut hole can worry people. So if you live in New York, sorry, Bobby, if you live in New York, there is a prescription assistance program called Epic. And if you qualify, it can really help reduce your costs. This program can be a real lifeline for those managing prescription drug costs, especially when you're getting through this donut hole thing. So if you're eligible, it can help you a lot. Let me just show you how that works. Okay, so to qualify, you need to meet a few key criteria. You have to be a New York resident, age 65 or older. You have to have income between $75,000 if you're single, or $100,000 if you're married, and you have to be enrolled in a Medicare Part D plan. And this one-of-a-kind program significantly will reduce your out-of-pocket prescription drug costs, particularly when you're in that donut hole. So here's what you get. You'll get premium assistance. If you're income eligible, you can significantly reduce your monthly cost for prescription drugs, making it more affordable when you need it. It'll also help you with your copays. This is especially important if you aren't fully covered by a Medicare Part D program. Here's why this is important. If, like, we have a client who was super healthy in January, in August, he just found out he's not super healthy. And so the Medicare plan that he signed up for at the beginning of the year wouldn't cover some of his new drug costs. That's why this is important. So again, it helps with that donut hole. And it helps with that catastrophic phase. So there's two programs. One is for folks that have very low income, and there's a fee plan. So they pay a fee to get in. There's no deductible. So if you are single and you make less than $20,000, or married making less than 26, your annual fee is between $8 and $300. That's billed quarterly. Your prescription your prescription copay is between $3 and $20. Your Medicare Part D premium assistance helps up to $48.72, no deductible. Now, if you make more than 20,000 and less than 75,000 single, or more than 26,000 and less than 100,000, there's no upfront fee, but there are deductibles. And that varies based on income. So again, these slides I will share with you, and I will make sure that if you've got questions on how to get engaged with Epic, we will be very happy to help you. Now, the other thing I want to say is some of us have parents that may not know about what we're learning today. We found that some of our clients, especially with Epic, their mom, who's widowed, could really use this. So even if you are not interested in this yet, maybe somebody you know could really appreciate learning more about this. Okay. So now let's start putting this thing together. So we've talked about how Medicare works and the gaps in coverage, talked a little bit about how to plan for out-of-pocket costs, especially around prescriptions. Long-term care is also something that we have to take into consideration. Now we need to start thinking about your personal needs, your budget, your healthcare plans that you have now probably won't be what they need to be when you're older. Let's go into this now. So inflation is an enormous part of the planning process. It's kind of startling to see that healthcare, the inflation rate on healthcare historically has been between 5 and 6% a year. So when I do financial planning for our families that we work with, that is an extra expense I pull out of your everyday expenses, because I would normally add a 2.5% inflation adjustment on everyday expenses long-term. But when it comes to Medicare and medical expenses, I really do try and bring that 5 to 6%. This data is from a group, and I've referred to where I got this data on the bottom, but Centers for Medicare and Medicaid Services, they actually confirmed showing that the healthcare spending continues to grow at about a 5.4% interest rate and is projected to continue that through 2028. No one really likes to talk about healthcare, and it's one of those biggest things that people don't know how to account for. And certainly it can, if you without the right planning, it can consume quite a bit of your expenses and retirement savings. And as costs rise, so does that expense. Failing to plan is not an option. You got to have a plan. So I found this slide pretty interesting also. This is gender-based. Women typically spend more in healthcare than men. We typically outlive men. And as women get older, the gap widens. And this is due to greater use of preventative services and treatment of chronic conditions, coupled with women's longer life expectancy. So you'll see that expenses go up. Healthcare costs rise significantly as you age. And if you need long-term care, when long-term care is, it can be nursing home expenses or in-home care that are not covered by Medicare, which is why long-term care planning is so important. Key takeaway, you really need to plan for increased costs. Okay, so let's break down a typical Medicare budget. This is part A, B, and D, not Medicare Advantage. So first we take into consideration Part B, premium. If you remember earlier, I mentioned that Part A is included in your Social Security, so there's no premium for that. But Part B does cover your doctor's visits, outpatient services, preventative care. I like to call it your annual well baby meeting. For 2024, the standard Part B premium was $174.70. Then in this calculation, we throw in a $200 budget for Medigap. Okay. Then we add the $40 for prescription copays. And when you add it together, it's shockingly $414.70 per person. Keep in mind, this does not include out-of-pocket costs like copays, co-insurance, and any uncovered services like dental, vision, or long-term care. So that means that a retiree should plan on a budget of over $400 a month, or about $5,000 a year, just to maintain their Medicare coverage. Okay. Now let's consider both premiums and out-of-pocket costs. The typical healthy Medicare beneficiary might spend over $6,000 per person a year. That does not cover those. This does cover dental, vision, acupuncture. That's the alternative care, maybe chiropractor. So that's $6,576. And again, I sound like a squeaky wheel, but what can cause your healthcare expenses to go up? Certainly inflation, but also the possibility of you needing more care because you get sick. So how can you plan for rising healthcare costs when you might be on a fixed income? Okay. Fidelity did this study. They do it every year. And again, these numbers are for 2024. They haven't, so they're pretty current. We assume that over a lifetime, people, and this one is covered for couples, will spend about $315,000 a year. That's the projection from Fidelity. The Employee Benefit Research Institute did a similar study with a slightly different variable and came up with 142,000 for men, 159 for women, and about 296 for couples, not too far off the Fidelity number. And again, it does not include long-term care needs. So, big time expense. This is definitely a separate presentation that we will dig into early next year. But long-term care can be in your home or in a nursing home or in a skilled care facility. So the important thing to know is that Medicare and Medigap, again, don't cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled care only. But if you're not sick enough for skilled care, they're not going to pay for it. And the average period of skilled care nursing is about 28 days. And when it comes to custodial care for help with activities such as I can't get out of bed, I can't dress myself, I can't go to the bathroom, there's no coverage for that at all. That's definitely long-term care. So here is an example of what the national averages are. And again, long-term care, like Medicare, happens in the county. So I'm going to show you, this is the national average, but here's Monroe County. And I have included a link to the website at Genworth so you can drill into your county. But if you look at the difference between, let me go back. So nationally, homemaker services, that's people coming in to help you cook and clean and maybe go grocery shopping, is $163 a day nationally, where in Rochester it's $200. So there's quite a difference here. Isn't this an exciting presentation? I bet you guys all want to throw up now. That was not my intent, by the way. So planning for these things are critical. It really does focus, long-term care really does focus on allowing you to have options so you can make a decision where you get your care. There are two ways, and again, this is a very quick slide on two ways to solve for this. This is a whole different presentation, but you can get long-term care insurance two different ways. One is a proper long-term care policy, and another one is a life insurance policy that has a rider for something called critical care. That type of policy is a hybrid policy. Way back when I started my career in this industry, in New York State, Genworth was a major provider of long-term care. They no longer do business in New York anymore. It just became so expensive for them to provide this kind of coverage that they got out of the business completely. So what we typically see is that folks are getting life insurance policies that will allow you to use the death benefit for coverage. These hybrid policies, actually, this is kind of neat now. These hybrid policies can cover two people because generally speaking, the probability of both folks in a relationship needing long-term care is about 50%. So the policies to cover this sort of need have evolved since the mid 2000s. So ways to manage costs, strategies. So we've talked a lot about Medicare, Medigap, the donut hole. You're not alone. There are specialists that help people choose the right coverage for themselves. They don't get paid by us. They don't get paid by you. They get paid the same amount by the insurance company that they help you find. So if you have an Excelis plan or an Aetna plan, they're not getting paid better by one or the other. It's all about them figuring out what your formulary is, what your needs are. They will help you understand what your options are so that if you have something in your, health history, you might want additional coverage. These are really great folks, and we find that they are, well, first of all, this is their busiest time of year, but they are so helpful for us because we don't do Medicare. We just understand it to help the planning portion, okay? The other thing is if you're still working and you have a high deductible health insurance with your employer, you might be able to fund a health savings account. And then if you don't have that, certainly building out a budget in your spending in retirement is critical. So this slide's a little redundant, but I still want to make it really importantly clear that inflation is key. Also, reviewing reviewing your budget annually and adjust for changes. I mentioned a minute ago, every year from December 15th until, October 15th to December 7th is when Medicare enrollment, open enrollment begins, okay? So if your plan this year needs to be changed, you can change it during open enrollment. So it's very important to look at that budget. So we've covered just an enormous amount of information here. I really want to let you guys know, whether you work with us or not, we would be very happy to answer any additional questions because a lot of this is very personal. Whether you're just beginning to plan for that future or if you're refining your current strategy, really now is an important time to act. I would say start reviewing your current financial plan with your advisor. Focus on areas like healthcare budgeting and retirement. Hopefully this presentation has given you some ideas on things that maybe you've overlooked or never thought about. And the adjustments that you make can make a significant improvement later on. And really this presentation is built around educating you so you kind of have some tools in your tool belt to address these things. So just real quick in review, we looked at what parts A, B, D, and C are. We talked a little bit about Medigap, talked about in New York, the EPIC program, which is EPIC, haha. The choices that you make on healthcare are very personal, so you want to make sure you get the right bundled coverage. We talked about inflation. We talked about we need to really plan for spending at least $300,000 per couple over a lifetime. The importance of budgeting is so important. Now, handouts. When the workshop is over today, you're going to get a survey, which would be very helpful in learning. If you could spend a little time on that, just let us know if we hit the mark, if we could have tuned it up a little bit. covering this amount of information in an hour is ticklish. But these handouts are important because it's going to help you. First of all, that Medicare and You is really important. It's current data for 2025. There's a Medicare quick guide, which I really like because it's like a one-sheet spreadsheet that'll say, well, I'm this age and this is what I might need. Talks a little bit about key dates. So if you retire early in the year, there are key dates for enrolling. If you're eligible, when you're eligible for Part A and B. So I have some folks that are retiring before their spouse, and they want to know if they're eligible for Part B. Some of that has to do with their work history. Some of that might have to do with their residency and citizenship. Some of it might have to do with whether their spouse has, if they're covered under a spouse's plan. So I think these 3 handouts are pretty spiffy. And that's it for today. I encourage you to take action. Start reviewing your personal health care and current budgeting. If you feel you need a little extra hand, I would be very happy to sit down with you guys. And I'm very grateful for the time you spent with us. But thank you. Any questions before we're finished?
I don't think
Anything else?
so.
Thank you, Chaz.
Yes. If anyone has a question later that they just didn't think of right now, just reach out and we'll get you on the calendar for a personalized call.
Thanks, everybody.
Thanks,
Have a great
everyone.
week.
Thanks.